Thank you for viewing this video on upper extremity injury patterns and prevention tips for musicians. It is meant to provide general information regarding problems and strategies to prevent and manage them. Please contact a qualified health professional if you experience pain with performing. There is an extensive referral network provided by the School of Music, Theater, and Dance. Hello, I am Lexi Muir-Pappas. I am an occupational therapist and certified hand therapist with Michigan Medicine. I have had the opportunity to work with many instrumentalists with upper extremity problems associated with playing. I will provide a brief overview of the prevalent injury patterns and share some tips and recommendations for your consideration. Research indicates that as high as 87% of musicians may incur pain at some point in their career. College students have rates of around 67%. A recent paper focusing on college musicians indicated woodwinds had the highest pain rates, followed by strings and piano, with the fingers on the right hand most prevalent. Unfortunately, only 25% sought help from a medical professional. When I began treating students over 20 years ago, I learned there was a stigma surrounding injuries because of the culture that promotes the idea that the show must go on. I'm happy to see this has changed significantly in the past 8 years, as evidenced by programs like the wellness program here within the School of Music, Theater, and Dance. It is my goal not to see you in our therapy clinics, but on the stage instead. The majority of musculoskeletal pain in the arm can be attributed to what are termed overuse syndromes, repetitive strain injuries, or cumulative trauma disorders. The terminology indicates the role of repetition as a causative factor. These can roughly be divided into two major categories: tendinitis or tendinopathies and myofascial pain from trigger points or muscle tightness and imbalance. You have likely heard of tendinitis, which means inflammation of the tendon. Tendons connect a muscle to a bone, and they generally have poor blood supply, making them more vulnerable to injury and slower to heal as a result. An example of a muscle injury is sore muscles from working out, resulting in tearing of muscle fibers. This can last a couple of days, but muscles are rich in blood supply, therefore heal fast. A large percentage of tendon problems in musicians occur in the elbow, wrist, and thumbs. A tendon can be irritated at the point where it connects with the bone at the origin or at the other end at its insertion. When the tendon is irritated on the inside or outside of the elbow, it is generally called medial or lateral epicondylitis. The more common names are golfer's or tennis elbow. In both conditions, the bone is very tender to the touch, and the muscles attaching the tendon to the bone are sore. Epicondylitis or tennis elbow on the outside of the forearm is painful when reaching with the elbow straight, such as reaching into a cupboard or placing a hanger in the closet, as well as even drinking from a cup. The muscles are responsible for lifting the wrist and fingers up, which musicians do millions of times. Medial epicondylitis or golfer's elbow is exacerbated by gripping and bending the wrist and fingers down, typing, texting, and forearm rotation, such as when using a screwdriver or turning a doorknob. Both conditions are very common in musicians. In the forearm, muscles transition to tendon again toward the insertion points at the wrist and on the fingers. Pain can occur on the top or bottom of the forearm from stressors related to finger positioning and overuse. This is termed flexor or extensor tendinitis and can also occur on the top of the wrist, bottom or sides of the wrist and hand, as well as the palm and fingers. Pain with resistance and force or repetition are primary complaints. Myofascial pain is the other component, which frequently coincides with tendinitis. Fascia is the filmy white tissue which surrounds a muscle and supports it. This can become tight and sticky, making movement difficult and referring pain to other areas. This can occur anywhere in the upper extremity and responds well to motion and massage. The third area of concern in the hand and arm are nerve compression syndromes. A nerve can be pinched at any point from where it travels from the neck to the fingertips. Nerves are responsible for telling our muscles to move, for sensation and transmission of pain, hot and cold, along with position sense and pressure. Nerves give you a clue when they are irritated by transmitting pain, symptoms usually burning in nature, numbness, tingling, or pins and needles. Awkward posture is the primary contributor to nerve impingement. Most common are carpal tunnel and cubital tunnel syndromes. The cubital tunnel is the area of the funny bone on the inside of the elbow. This nerve can be overstretched when the elbow is bent past 90 degrees and irritated by leaning on it, as there is no padding in that area. If you have hit your funny bone, you know it's not so funny. Any instrument which requires frequent bending of the elbow past 90 degrees, particularly with force, as in strings or flute, have a high incidence of this combined with awkward positioning of the neck. The carpal tunnel is located at the base of the palm. The nerve travels with 9 tendons to the fingers inside a tunnel, which is the size of a dime. Any swelling compresses the nerve with the symptoms of numbness, tingling, or a pins and needles feeling in the thumb, index, middle, and one half of the ring finger. The symptoms tend to be worse at night when you are trying to rest. Once the nerve is irritated, any bending of the wrist in any manner or resting on the palm, for example, typing on a laptop, along with repetitive grip activities can exacerbate symptoms. All the problems noted are related to the amount of time spent in the awkward postures. The injuries are more common in women than men due to smaller tendon attachments. A grading system for severity of injury includes Grade 1, pain while playing or for a short time after. This responds to changes in technique. Grade 2, pain lasting hours after playing. This responds to a decrease in practice time by 50% or shorter duration sessions, along with shadow playing and mental rehearsal. Grade 3, pain progresses during playing, requiring practice session to be shortened, but resolves between sessions. This will also respond to a decrease in practice time, a shorter duration session, or shadow playing and mental rehearsal. Grade 4, pain worsens while playing and does not totally resolve between playing sessions. It's best to seek medical attention, and you may need relative rest. Grade 5, continuous pain that reduces or prevents playing. It is recommended to seek medical attention. Risk factors preceding potential injury include high volume of practice time, sudden increase in practice time, new music or more difficult repertoire, intensity of performance schedule, multiple instruments, a new instrument, or an instrument in poor condition, younger age, years of experience, anatomical structural differences including hypermobility of joints. Women have greater injury rates than men, repetitive non-musician activities including computer, phone. The highest risk factors preceding potential injury are lack of aerobic exercise, sedentary lifestyle, positioning and errors in technique. What can you do? I have found when I ask most musicians how they warm up before playing, they usually tell me they do scales. Some respond by saying they do a few stretches prior. Those are good, but they should be preceded with a physical warm-up of your body. This could be done by performing 5 minutes of aerobic exercise, which elevates heart rate and perfuses blood and oxygen to your muscles. A warm muscle tendon unit is much less likely to be injured. You can do this by walking briskly to classes, or once inside the building, going up and down the stairs a few times. If you have a Fitbit or Apple Watch that tells you your heart rate, try to get it up to 110 beats per minute. Follow this light warm-up by movement of each segment, starting with your neck. Turning your head to look over your shoulder, keeping your head level, hold for a count of 5, doing this 5 to 10 repetitions in each direction. Follow this by letting your head relax to the side over your shoulder. Again, going in both directions, holding for a count of 5, 5 to 10 repetitions. Next, focus on your shoulders, doing shoulder circles backwards, never forward as we spend the entire day forward. Followed by backwards motions of your arms, like swimming the backstroke. Next, swing your arms side to side to include some motion of the torso. Moving to the elbows, bend and straighten. You can do this several times. And for your forearms, imagine the number 8 lying on its side. Follow with your forearms up and down. For the wrist, make a fist moving up and down 10 times, holding for a quick count of 5 in each direction. Follow this with circles, both directions, moving counterclockwise and clockwise. Moving on to the thumb, making a nice O, thumb to each fingertip. Followed by thumb sweeps across the palm and opening up the palm really wide in between. Our warm-up of the upper extremity will end with tendon glides for the fingers. We start with your fingers in a hook. The end joints are bent. Straighten, followed by what we call a tabletop. Straighten, flat fist, straighten, full fist, straighten. This is 1 repetition. Hook, straighten, tabletop, straighten, flat fist, straighten, full fist, straighten. I recommend 10 repetitions. Another option I prefer for a warm-up with my patients in the clinic is to throw a couple of scarves, which takes care of the aerobic exercise portion and provides thorough functional movement patterns for the upper extremities. We emphasize going across the body, tossing it up as high as possible to get your shoulders, everything stretched. Then we drop 1, going behind your back, both directions. We're emphasizing getting the front of the shoulder stretched. Going the other way. Followed by tossing it behind your back and catching it with your opposite hand. And ending with the lunge pattern. Bend down, place it under your knees, and back up. Now, after all of that, you are ready to do your scales. Other prevention tips include: plan your practice and rehearsals. Try not to wait until the last minute. Think like you are a marathon runner. Train gradually to prevent injury. Take frequent breaks. Poor posture worsens with fatigue. A good rule of thumb is taking a break every 45 minutes. For the neck, avoid forward head posturing when on your phone and computer, not just when playing. You can control computer and phone use, but cannot change the way an instrument's made. Avoid raising your shoulders above 90 degrees when playing and keeping them back. You can practice this when you're sitting in class or watching TV, which will help to strengthen your muscles. For your elbows, avoid leaning on them or excessive bending past 90 degrees. For the wrist, keep them straight in what we consider neutral position with your fingers relaxed. Avoid pressure on your wrist when you are typing. Long stretches after playing help. Try for the opposite direction. Pace yourself, alternate fast and slow tempos, avoid forceful playing. Mental rehearsal and mindful practice are very helpful. Hydrate. Work out to be physically fit, to have better endurance. Avoid marathon phone use, computer use, and make good posture a habit. When issues arise, always contact a medical professional who can assist you with addressing your concerns. Thank you for your attention.